Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Hello, welcome to Dr. Jeff Talks About Sex and Intimacy. I'm your host, Dr. Jeffrey Albaugh. As bodies change, so do the ways we experience desire, arousal, and pleasure. So today, you're joining us for episode 68, Male Infertility, Vasectomy Reversal, and the Science of Second Chances. Whether you're watching live or listening to the recording later, every moment of your amazing life matters. And I count it a true blessing and a gift to have you joining us to improve your life. I sincerely thank you. I want you to know that you are exactly what this podcast is all about. We are connected across so many platforms: Facebook, YouTube, X, LinkedIn. If you're on X and you need to submit a question, jump over to one of the other platforms and you can do it. If you are a Facebook person, a quick favor, we need followers on Facebook. The more people who follow us, the more we can do on Facebook. So we appreciate all of our followers. Don't forget to visit the website. You can learn more about all the upcoming episodes by pulling up the calendar. We have amazing guest book all the way through July. You can watch all the previous episodes, and there's 67 of them, so lots of episodes that you can watch. And so also you can take us with us. If you're going on the road, if you're working out, wherever you're going, take Dr. Jeff Talks About Sex and Intimacy along with you. We are on your favorite streaming services: Spotify, Amazon Music, iHeartRadio. Don't go on a trip without us. Take us along. If you're working out, what a great way to work out. Learn as you go. As always, I'd like to take just a moment to say that all are welcome here, whatever your sexual orientation, whatever your gender identity or your relationship style, you are so welcome here. This podcast was designed and made for you. Thanks for being here. The mission of the podcast is really simple. It's to empower and enlighten you with the scientific-based information that you need to help improve your sexual health and to deepen your relationships so you can live your one miraculous, wholehearted life with more love. Who doesn't want more of that? Well, today's conversation is about possibility, change, and second chances. Many people think of vasectomy as permanent, but let's face it, life doesn't always follow a straight path. Relationships evolve, goals shift, and the desire to build or expand a family may reemerge in some unexpected ways. So in this episode, we're diving into male infertility and vasectomy reversal with one of the leading experts in the field, Dr. Landon Trost. We'll explore what's really possible with today's advanced microsurgical techniques, what factors influence success, and how individuals and couples can make more informed, meaningful decisions about their reproductive future. My guest today, Dr. Landon Trost, is a fellowship-trained urologist specializing in male infertility, microsurgery, and men's reproductive health. He's widely recognized for his expertise in vasectomy reversal and complex fertility restoration procedures, and he has performed thousands of microsurgical cases with a focus on optimizing outcomes and patient-centered care. Dr. Trost has contributed extensively to the scientific literature and is a respected educator and speaker in the field of andrology and male reproductive health. His work emphasizes not only technical excellence, he came out of surgery today and took time to join us, but also helping patients and couples navigate the emotional and relational aspects of fertility decisions. Through his clinical care research and teaching, Dr. Trost is advancing the science and, we always do this on this show, the hope behind male fertility and second chances. I am excited to welcome once again, we have had him before, he is an excellent speaker and guest, my friend and colleague, Dr. Landon Trost. Welcome.
Well, thank you, Jeff. Thanks for having me, and good to be with you again. Feelings very mutual.
We're always excited to have you here. You are just the best. And I can't wait to hear your amazing presentation on this important subject. So I'm going to hand it over to you. It's all you.
Certainly, yeah, my pleasure. And happy to go through this, and then we can talk after if there's any additional questions or anything we want to kind of go through. So yeah, very pleased to be able to talk about male infertility in general, as well as vasectomy reversal, and specifically emphasizing some of the psychological aspects of this and the kind of this concept of science of second chances. I don't have any relevant disclosures for this particular talk. Well, just high level, quick background. So like, it was mentioned, I did a fellowship in andrology, which is basically the study of men. And that's kind of goes through the infertility side of things, the sexual medicine side of things. I then served as an andrologist at Mayo Clinic, and now have a practice that focuses specifically on Peyronie's disease and vasectomy reversals. We do a high volume of vasectomy reversals. So when you look at the largest publication ever on this topic, it has about 4,000 cases that were performed over a period of roughly 40 years. But in contrast, we do about 1,200 per year. So we do a real high number of these types of procedures. So it helps in being able to try to discover new things or solve some of the problems that are existing and out there. Now, just some basic stats on reversals themselves. So there's a little over 500,000 vasectomies performed each year in the United States. When you think about that, that's a huge number. And despite that, about 20% of them experience some degree of regret at some point and consider undergoing a reversal. And that can be due to various things. It could be an unstable relationship. It could be men who are under 30 are more likely to have a desire to undergo a reversal at some point. Sometimes they don't have kids when they have the vasectomy, or very young kids. Sometimes it's related to complications of pregnancy, or it can even just be a financial crisis, as much or more than anything. So that brings up this question. So, what percentage of men, and this is just rhetorical, but what percentage of men that desire a child post-vasectomy actually do a reversal? And, is it anywhere from less than 5 all the way up to more than 90? In reality, it's less than 5% of those who want a reversal will actually do it. So that begs the question, well, why? Why is it so low compared to all those who are desiring with it? A big part of it is just unaware. It's very common among patients and physicians that someone will say, oh, it's permanent. You can't undergo a reversal. This is meant to be a permanent procedure. Or sometimes people want a faster pregnancy. They want to do IVF and get pregnant that month. There can be female, not that month, maybe the next month. There can be female factors that are involved. It could be a perceived cost. Or some men just don't want to have surgery in that area of the body. In fact, I'd say all men don't want to have surgery in that area of the body. And a little side note there, technically all, whether you do IVF or reversal, you need surgery in that area to get sperm out. So I just wanted to go real high level here of looking at your two options after you've had a vasectomy. You can either do in vitro fertilization, or you can do a vasectomy reversal. So when you look at the two, so on the left is just an illustration we did at Mayo that shows kind of the concept of a vasectomy reversal versus IVF. IVF itself is somewhat involved. You have to do some medications on the female side that get the ovaries ready to basically generate multiple eggs. You then retrieve the eggs externally. You take the eggs out, you put them in a dish, you fertilize them or directly fertilize them through something called ICSI. You then culture it up for a period of time, transfer the embryos back into the uterus, and then confirm whether or not a pregnancy occurred with it. And usually one cycle of IVF, like I mentioned earlier, is about 2 months when you do kind of start to finish, when you start the whole process. And when you compare that on the male side, what do you have to do for IVF? Well, you have to retrieve sperm, and there's different ways you can do this. You can do what's called a TESI or a MESA or a vasectomy reversal that then can get sperm out through the ejaculate. And these are surgical procedures, all very minor, where you are able to retrieve sperm for it. Some of the newer technologies over the past couple of decades include what's called ICSI, or intracytoplasmic sperm injection, where you can take essentially a really tiny needle and inject a single sperm into an egg. Or you can just put the egg in a dish, put sperm around it in the more traditional IVF type approach. Either of these are viable depending on the certain circumstances. These then grow up, and you can see under a microscope here what the egg looks like at different times once it's fertilized and turns into a blastocyst, the different stages. Day 5 is about the time when you start to make a final decision as to whether or not to implant. Vasectomy reversal, so just a little quick animation here of what that entails. And this is, of course, a little bit cleaner than in reality. Digital animations always, brush up some of the details on it. But so you make your incision to get down to the prior site of the vasectomy. And you can do this different ways, but once you remove the area of the prior vasectomy, you'll then sample the testicular end of the vas deferens. And if you see swimming sperm, then you can just attach vas to vas, as will be shown here. If you don't see swimming sperm, then you have to do what's on the right side here, where you attach the vas to the epididymis. So it's a little bit more involved of a process overall. You then sample it to make sure that you are indeed attaching two sperm, and then you can put that back together, put the testicle back in the scrotum, and then restore everything the way it was, close up the incision. So overall, this is about a 3-hour surgery or so, anywhere between 2.5 to maybe 4 hours, kind of depending what has to be done complication-wise. Well, there's advantages either way. So on the in vitro side, this is faster, as far as faster per attempt, because within 2 months, you're going to know whether or not that cycle worked. It's also very good for schedules. If you have someone who has a real tight schedule, has to be pregnant on certain months, IVF is definitely the better way to go. It has a very limited role on the male side. Once you get sperm out, they're essentially done. There's not anything more that needs to occur there typically. And sometimes you have to do IVF. So certain scenarios on the female side may require IVF with no real options. Vasectomy reversal alone wouldn't be able to accomplish those same purposes. You can also do pre-implantation genetic testing if there is a certain genetic trait that you don't want to pass on to kids. IVF has that ability. And typically, when you look costs, you're looking about $15,000 to $20,000 for the first cycle and $5,000 to $8,000 for each additional cycle, as far as when you don't have to do a complete new from the start. And that's in addition to the male side. For reversals, they are a little bit less invasive and they're less risky on the female side. They definitely are more cost effective because they'll be anywhere from $2,000 to $12,000 for the reversal versus $15,000 to $20,000 for IVF. You can have children naturally, so just through natural intercourse, and you can have multiple children with just a single procedure. And overall, if you say what are the success rates with a single procedure, they do have a higher success rate when you go to someone who does a lot of these or have high volume centers. Now, success rates on the IVF side, there's a great website called SART, so it's SART.org. And you can go there, and this is a little bit older page. They, of course, changed often, but then you can go to this IVF success section, and you'll be able to type in your zip code, and it'll show you the anticipated success rates depending on where you're living. And this is what the page will typically look like, and it'll break it down by age of the female partner, and they'll look at overall live births or just singleton births, so single birth. And you can see live births per intended egg retrieval all the way down per these different options. And you can see that it's heavily age dependent. So if you're over 42, you're looking at roughly a 3% chance. And this is just one particular center. So every center is going to be a little bit different. Versus if you're under 35, you're up to 42% chance of live birth. Now, how about reversals? So this was from one of our recent studies where we did a randomized control trial looking at different medications you can use to try to optimize outcomes. And you can see the pregnancy rate. Now, these were women under 35. So again, if you're comparing it to IVF, you're looking roughly 40s, maybe 50s. Success rate here. Pregnancy is going to be in that kind of 60 to 70 range. We're looking specifically at the control and prednisone low groups. These other ones we learned you don't want to do, these particular therapies post-reversal because of how they impact outcomes. But you can also see there's different ways of tracking success. So what's the likelihood of patency or having sperm at any point? And that's roughly in the kind of mid to upper 90s, kind of depending on which study and which group. And depending how high of a concentration you look at, your success rates can vary from that too. But again, overall pregnancy is kind of the key thing people are looking at when they're doing a reversal. So again, patency, depending on the study, will range from 70 to 99. Pregnancy will be anywhere to 22 to 72%. And their outcomes are heavily variable, highly variable. It depends on if the surgeon can do what are called EVs or epididymal vasostomies. Depends on the surgeon volume, the technique you use, post-op protocols, and which data people are excluding when they're publishing their results. It also depends on time. If you're 30 years out from your vasectomy, then the likelihood of needing these more complex repairs goes up, and the overall chance of sperm coming back is going to go down. Whereas if you're 5 years out, you've got a much higher chance of success overall as far as long-term sperm counts, for example. And again, this just highlights two different approaches for performing these types of repairs. And like I mentioned, the longer it's been, the overall total motile sperm counts will go down just because this testicle scars up a little bit the longer it's been since you've had a vasectomy. And that's shown in a couple different ways. You've got this graph, then you show the same thing over here. This is an older study that showed that their pregnancy rates did decline the longer it's been since someone has been out from their vasectomy. And that does vary depending on the study itself. All right, surgical procedure. So for pre-op, there's not a ton required for a reversal. You just need to make sure that you can limit your activities afterwards. If you're in the military or in law enforcement, things like that, and you have to be real active, it's not going to be great to do a reversal because you're just going to rip it apart. You also want to make sure you're off of testosterone for at least 6 to 12 months, ideally, or even longer if you can. You need to be ready to achieve a pregnancy right away, and you want to make sure that, at least on the female side, there's no clear known risk factors if you can avoid them. Procedure, it's about anywhere from 2.5 to 4 hours is typical. It can go all the way up to 6 hours in case of real complex cases. Anesthesia can vary, so you can do it just with numbing medicine alone. You can give oral sedation as well. You can do IV sedation, or you can do the full general endotracheal type intubation. If you do some of these top ones, you can actually eat during the case. You can watch TV shows, things like that. So it's not a real high risk type procedure. Post-op, we recommend that people act like a sick 80-year-old man for 2 months, just to really limit your activities. We tell people they really need to focus on trying to get pregnant right away, even that first month, just in case it does scar down later. We also recommend saving up the ejaculate for the first few months in particular, and only ejaculate around the time of ovulation. So don't skip the first month, but only ejaculate when it's around that time of ovulation. We also tell people to be real careful of sexual positions the first 2 months because you don't want to rip anything apart. And again, prednisone, our latest data says that prednisone likely has a significant long-term benefit in preventing long-term scarring down. And that's shown by this study. So again, this was that randomized trial that showed if you did this low dose protocol of prednisone, your pregnancy rates were just as good long-term, but importantly, your long-term sperm rates or your sperm concentration was better compared to if you didn't do it. And we followed the study all the way out to 3 years, and I don't have the data presented here yet, but there's a greater and greater separation that we see in sperm counts of those who did prednisone versus those who didn't. And again, this is shown when you look nationally. We did a study where we anonymously got data from different surgeons from around the country. And it was quite surprising when we looked at the difference in outcomes depending on surgeon. And these are all high volume, experienced, fellowship trained surgeons who do a lot of reversals. And you can see you've got, this person's up in the 15 million at, 7 to 10 months sperm count range, whereas these people are down in the 0 range. So really quite a dramatic difference depending on technique and volume. Overall, we saw that concentrations did decline over time, just people tended to scar over sperm count wise. Whereas again, that's highly variable depending on the surgeon themselves. If a repair is unsuccessful, you can always redo it. So they have similar success rates to a first-time case. You can't always do that if you had to do complex repairs before. You can also do IVF. And this often does become a numbers game, where sometimes you just have to throw a couple things at the wall and then eventually, to be successful. It's also very important to set expectations that it's not always a one and done type thing with either IVF or reversal. Sometimes you have to do a couple things to be able to achieve a pregnancy. Not a lot of complications post-reversal. You can get a bleed or a hematoma. You can get infections. You can get chronic pain, but none of these are very common. All of these, of course, are going to be higher if you're doing a redo type reversal or an epididymal vasostomy or these more complex type repairs. All right, I just wanted to end on these psychological aspects. These are some of the more interesting, pieces that are related to infertility in general. But psychological aspects with infertility are definitely significant. I think it's really tough to understate how significant these can be. But, when you look at these, is it a female thing, a male thing, or both? And when you look at anxiety, so the way you read these types of figures is we've got women over here, men over here. If the data are more on this side, that means it affects women more. So when you look at how much does infertility affect women, and this is individual studies, each one of these are an individual study, you can see clearly it affects women much more than men overall. And that's true with depression. So again, you see that, there's an occasional study that'll say men get depressed more than women with infertility, but clearly the numbers overall are heavily in favor of women. Stress, so stress-related infertility, it affects women more. Self-esteem, now this is actually better in the sake of men here, so it shows that men will have higher self-esteem as it relates to infertility compared to women. Now, granted, there's only 3 studies here, but they do appear to say that women experience lower self-esteem as it relates to infertility. And so you'd say, okay, well, good. At least one of the two in the couple, is doing well. But as everyone knows, in a couple, it's two people. What affects one person affects the whole couple. And so then it rounds it out of, well, does counseling have any, significant role here? And without a doubt, counseling has a dramatic impact on couples undergoing infertility. Now, this isn't necessarily couples that are struggling in their relationship or anything like that, but all that data I just showed you highlights how this affects the couple because it significantly affects, in particular, on the female side of it. And so if you look at, well, if you counsel during this time, so during infertility, it'll improve not only marital satisfaction, but sexual satisfaction as well by quite a bit. So these data show that this is a real strong effect that counseling can have on improving the relationship during this time. And with that, I know we were going to do a real quick 15-minute overview, so just wanted to stop there and talk more and answer any questions you might have.
Awesome. Excellent. Gosh, so much good information. Really appreciate that. I was thinking a couple things kind of stood out to me that I thought were interesting. First off, I was like, gosh, you guys do a lot of this surgery, a lot of this surgery. So it's nice because you have a lot of good data to kind of help and guide you through it. So, and I love how you talked about the recovery, like live your life sort of like an 80-year-old man moving kind of slow.
There's some healthy 80-year-olds out there.
I know, definitely. There are some really healthy ones. So you want to think someone who's a little more inhibited in their activity and everything like that. And that's really important for people to know that that's about 2 months of really kind of approaching things different so that they don't tear things apart or mess up what's been done. It's a big deal. Another thing I thought was interesting was too that people gives them hope is the fact that they can redo things. It's not just necessarily a one and done. It may be a little more of a process than that. And I think that's important for people to understand and know. Yeah. Do you do a lot of redos?
No, it probably makes up about 5% of the practice or redos with it. And yeah, I agree. Like, I think it's nice for people to see that there are options, after the case or after you getting a vasectomy where you think, oh, that's it. And, there's no success rates or anything, or things have such a low success rate. But indeed, as long as the team has a high volume and high experience, success rates are very high. And when you combine first time and redos, those numbers all jump even higher. Now, as we get older, and unfortunately in fertility, 35 is old for women. Nothing else in medicine is, but fertility it is. Then success rates do start to decline just because fertility starts to drop, and it's just kind of the nature of how things are. But yeah, I agree.
Yeah, you led perfectly into our first question that came across. And it is, I'm 48 and considering a reversal, but I keep wondering, am I too late for this to work, or is there still a reasonable chance?
On the male side, no problem. On the female side, 48 would be on the higher end where the reversal may work, but the success with the overall chance of pregnancy would certainly be lower. Now, that said, our record is a 51-year-old, post reversal, where the female partner was 51. Our record on the male side is 84. And so he was 46 years out from his vasectomy. So it's just crazy. But so they do work. And in fact, after about 12 years, they level off. So whether you're 12 years out, 30 years out, 40 years out, your success rate is going to be very similar at that point. They do tend to get worse early on. If you catch it within like 6 months, they do a little worse than someone in that 2 to 5 year range. And then they do a little worse after 5 years. But overall, they still, chance of patency is very high.
Wow. So this listener, basically your answer is not a problem, but you are kind of highlighting what my wife says all the time. It's so unfair. Everything for women is more complicated and more difficult.
Yeah, there's a clear double standard. Yeah.
I'm just going to throw that out there because she's always like, everything, weight loss, everything. And then even like you said, my wife, when we had our second child, they're like, oh, you're geriatric, because she was in her mid 30s. And she's like, really? Yeah. It's like, that's it's an older pregnancy, a high risk. So everything seems to be unfair when it comes to these things. And this, I guess, too, but it sounds like that listener should be fine. I really liked how you talked about and how you get on top of some of this I know all of my infertility patients they're so nervous, they're anxious, they're so uptight about everything. And I think half of the problems that they're having are because they're so uptight, timing sex and trying to get it all right. And they're not really enjoying intimacy and sex oftentimes. And so as a sexuality counselor, we talk a lot about kind of pulling that pressure back and, step back a little and just remembering that you want to enjoy sex and intimacy besides the reproductive pieces of it. So I really like that you talked about the importance of that and how counseling can make a real big difference even when they're going through this. I thought that was really cool.
It's interesting. I skipped over it kind of fast just because, 15 minutes isn't a ton to go into a lot of detail on things. But that study we did, the randomized trial where we gave different doses of prednisone, and again, for the listeners, prednisone is like a stress hormone. So your body naturally produces these glucocorticoids when you're in response to different stresses. And we gave high dose or just kind of a taper type dose or a real low dose. So very surprisingly, the high dose ones, they had good sperm counts, but they did not get pregnant. And when we gave it on a regular basis, almost none of them got pregnant. And we've known for decades that stressed couples don't get pregnant, but we've never known why. And this was the first time where we showed that indeed, if you give someone these high stress dose of these glucocorticoids, they don't get pregnant. Even though the sperm counts look great, the men cannot fertilize. And so it now gives a mechanism that this might actually be a glucocorticoid type thing. And it is a real thing. If you're stressed, whether it's sleep, missing sleep or stress with job or stress with money, stress with whatever, you might be causing the infertility because of that normal stress response. So it's real neat findings.
Wow, that is really cool. I think it's so true because I find these stressed couples, they're really struggling with the fertility issues and so stressed out about sex and everything else. And so now we kind of know, and you see in the research as well, that anxiety affects everything. It affects erections, it affects sex, it affects all of it. So really important, I think, to be proactive about that and maybe don't be afraid to reach out and work with a therapist or counselor. I think it can be really important. And so my next question, I think, fits really well with that. This process has been harder emotionally than I expected. As a man, I didn't anticipate feeling this much pressure or even guilt. It sounds like you see a lot of that. You see that a lot. So how can we cope with it as a couple? And I think we've answered some of that, a counselor, a therapist, but great question.
No, I agree. Yeah. And it's surprising because a lot of times, most people that do this do it because of a new partner. And a lot of times the guys themselves don't feel strongly about reversing it, but they love their partner. They want to support them. They want to do anything they can. And so it's not that they're just dying to have a baby or anything like that. It's that their partner really, really wants to, and they want to, be there for them. And you do see this. In fact, we've seen couples fighting during the surgery because there's a lot of interesting stories, Jeff, if you want to get into some of these. But yeah, we've had ones where she's like, you got this. This was your fault. I did not want, that type of thing. And certainly that puts a lot of stress on the guy and they'll feel guilty for, it's because of me that we can't have it. But it's also showing that we can fix that. We can get things back. Now, you can't always get it exactly like it was, and not all surgeries work and everything's there, but there are options available and there are options that kind of open things up. I think the key thing is, as always, it's this concept of validation, of recognition, of, speaking back what you're hearing. It's a lot of these, what they call soft skills are really, really important in any and all relationships. And the decision was made, it's there. And now it's move forward and here's what we can do. Here's how we can improve things and how we can be constructive. But it's a real thing. Yeah, that stress and the anxiety and the pressure and the blame, they're all aspects of this for sure.
So often I spend so much time really working with both my men with erectile dysfunction, my couples with sexual dysfunction, and couples with infertility, just understanding and removing all the shame and blame. Even with, sexual dysfunction, I say, this isn't your fault. It's not your fault you have diabetes and therefore you have erectile dysfunction. It's nobody's fault. It's nobody's fault, the infertility issues, or that you need a reversal because you made a decision based on other information in the past and now things had to go different. So I think it's really important with these couples to help them see, let's get rid of the shame and blame. It's nobody's fault. and you've made decisions. Now let's get your mind, your body, your spirit around moving forward with this process that you've decided to engage in to bring another human being into the world, which can be a beautiful thing. So, but sometimes, you know as well as I do, and I'm sure you have incredible stories just like I do, we see all kinds of craziness, and it's like, wow, this doesn't seem like a beautiful process, but it should, but it really should be. The sex should be fun, the intimacy should be fun, and it should be a really sacred thing to be involved with bringing another human being into the world. So sometimes you just got to kind of bring them back and remind them of some of that. But working with a counselor or therapist is such a great idea.
Yeah.
I really think that's good. Gosh, so much great information packed into this episode. I really, truly appreciate it. I'm going to come back to you and see if you have any final words, anything you want to sum up as we come back in just a minute. But I'm going to do, as I always do, a centering exercise real quick with our listeners. This is what we do at this point as we begin to close out today's episode. Okay. You've heard all kinds of information, medical information, things that hopefully will help you move forward. But let's take a moment to pause, reconnect with yourself. If you're in a comfortable place, gently place a hand over your heart or your abdomen. So you can do that. Get comfortable, feet on the ground. Take a slow breath in through your nose. And exhale softly through your mouth. Again, inhale and exhale. Continue that breathing pattern. If today's conversation brought up uncertainty, hope, or even grief, just notice those feelings. Just notice them without needing to change them. Fertility journeys and decisions about family, they are deeply, deeply personal. There's no single right path. Only your path. As you breathe, consider this gentle reflection in your nose, gently out your mouth. I can honor where I've been while staying open to what's possible. I can honor where I've been while staying open to what's possible. Take one more slow, grounding breath. When you're ready, carry that sense of compassion and openness with you into the rest of your day. Often we're not real compassionate with ourselves. We tend to be hard on ourselves. Bring a little bit of that love and compassion you would share with somebody you really care about with yourself. Vic, can you tell us what's up next week on Dr. Jeff Talks About Sex and Intimacy?
Gratitude is more than saying thank you. It's a mindset that can profoundly shape how we experience ourselves, our relationships, and our lives. In this episode, Dr. Jeff explores what gratitude truly is, how it differs from positivity or obligation, and why it matters so deeply for emotional and relational well-being. Drawing on research and real-life examples, we unpack the physical, psychological, and relational benefits of practicing gratitude. From reduced stress and improved mood to greater intimacy and connection with our partners. Join us on April 28th at 7 p.m. Central Time to learn more.
Well, this has been such a great episode, and I got to tell you, we always have so much information packed in. We've been trying to keep to this more of this 30-minute mark, and you did an incredible job today helping us keep to that mark. Also, gosh, I know you had a busy day in surgery. I can't thank you enough for sharing your amazing expertise with our listeners. Thank you for taking time to do that. Any final words for listeners today?
No, thanks, Jeff. That's nice of you to say, and certainly my pleasure. The feeling is very, very mutual, like I said. No, I think you summed it up very well in your final words. Life changes. You know, everyone thinks, oh, I've got life planned out. I know exactly what's going to happen, and you do for a while, and then stuff changes. And when that happens, just there are opportunities you can undo the effects of prior decisions. And like you mentioned several times, there's so much joy that comes in bringing children into the world, and any amount of effort, energy it's one of those things you never regret. And there's a lot of benefits with it. So yeah, I think you summed it up very nicely.
Well, gosh, I can't thank you enough. You are so generous with your time, and I know you are so incredibly busy between your teaching, your surgeries, your patient load, and your family. So I just can't thank you enough for taking time with us. I really appreciate it. And listeners, as we said, I know it's really hard not to let things make you crazy, like infertility things and trying to figure all this stuff out and navigate your way through it. I know it's hard not to get frustrated and upset. But joy and gratitude are beautiful things. So take time to be in this moment with your partner and to love more and to live more. Thanks for joining us.
As Dr. Jeff talks about sex